Good afternoon. I am Dr. Spicher, here with another installment of Coronavirus Update. We've been doing this now for over a year, and who would have thought a year ago when we first started this where we would be now, what we've learned over the last year, what kind of effect this has had on all of us, our residents, our country, our world, really. And we're still learning. And so what I hope to do today is just update some of the new things since our last talk and spend some time talking about vaccines. Today's talk is going to have a lot of charts and graphs and numbers to try to illustrate what's happening and try to illustrate what we know and have learned about the virus. But I would encourage you all to remember that those numbers and those charts and those graphs, those all represent people's lives. And so just encourage you to not get lost in the numbers and the graphs and the facts and the details, but to reflect on the fact that each one of those little points of data, those represent an individual's life. They represent maybe an illness, and that we have all this past year been touched, I think, in very profound ways by this epidemic. Just for review, remember, I think it bears repeating, the thing that is so difficult about this virus is that it is infectious before you know you're sick. And so there's this time period before, after you pick up the virus and before you get sick with the virus, when you can be spreading it around. And the other thing that's very tricky about this virus is that there are quite a few people who don't ever actually get sick, but they continue to spread it. And so that has been a real challenge, and unlike a lot of viral illnesses that we've dealt with in the past, trying to figure out how to manage a virus that can spread from person to person without individuals being aware that they're even sick. Again, maybe as many as a half of spread is probably caused by people who are asymptomatic. And this is how it can spread so silently in the community and before people are aware of what's happening. Unfortunately, people who are asymptomatic can be just as infectious as those who are symptomatic. And we tend to see this more commonly in younger people. In terms of how the virus is transferred, again, not a lot has changed here. Pretty clear that this is a droplet kind of transfer rather than what we call an aerosol, meaning that there has to be some proximity for it to go from person to person, unless there is a lot of airflow or a breeze. There have been some situations where if there's a really strong breeze and someone is sitting farther away from somebody else, they've gotten infected at distances of greater than 6 feet. But in general, people tend to get it from people that they're close to, close proximity. That's the 6-foot rule that everybody's familiar with. And again, people are most infectious at the beginning of their illness if they have symptoms. And remember back at the beginning, a year ago, we were all worried about our groceries and everything we touched, and now we don't worry about those things so much anymore. We're finding that it's much less likely spread by objects and much more by who we're with and what we're breathing. One of the things that we have learned since I talked to you last is how much immunity do we have after we've had COVID? So there was recently a study in Denmark where they looked at this question, and they looked at people who had COVID, and they looked at them 6 months after they had COVID. And what they found is that after 6 months, There was in general, about 80% protection, so that 80% of people who had had COVID were not going to get reinfected at 6 months' time. However, if you're older than 65, that is not true. So people who are older than 65 are at a greater risk to get reinfected with COVID. And so your protection after having a case of COVID, if you're over 65, is really only about 47% at 6 months. So again, this question of how much immunity does one have after you've been infected, and how does that compare to vaccination? So it looks like there is some degree of protection, pretty good for at least 6 months, unless you're older. The other thing that you're hearing a lot about, and we didn't really talk about before, was the issue of the variants. Coronaviruses, every time they replicate, they make a copy of themselves and they pass on their genes to the next generation of viruses. Errors can happen when that replication happens, and that can cause a mutation. Most of those mutations don't amount to anything, and they actually don't help the virus. But occasionally, one of those mutations comes along and it changes the virus a little bit, such that it becomes more efficient at infecting people, or it actually becomes more serious and people can get sicker from it. So the more opportunities the virus has to replicate, to spread, the more opportunities by chance there are that a virus can develop a mutation that is to the virus's advantage. And so what we have found in the last several months is that there are so-called variants, or viruses that are just a little bit changed from the original virus, that are more dangerous and spread more easily. We call those the coronavirus variants. And we have found that these variants are less responsive to some treatments, particularly the monoclonal antibodies. So the monoclonal antibodies don't work as well in the variants. And even some of the vaccines don't work as well on some of the variants. So this is an ongoing kind of thing that's being monitored, and we may need to, at some point in time, actually modify or change our vaccines a little bit if the variants become very common and it becomes more of a problem. Certainly, all the mitigation efforts that we all know about, that we were all doing before we had vaccines, those are still important, and the mutations in the variants aren't going to change the effectiveness of those measures. So wearing masks and social distancing, those are all still very important things. The three variants that are of most concern commonly right now, and there are literally hundreds of different variants, but the ones that seem to have caused the most concern are the B.1.1.7. This is the so-called UK variant, the one that arose first in the United Kingdom. And that's probably the variant that is most common in this country right now. And estimates are that this is responsible for as much of 25% of our current infections in this country. And within a month or so, it may be the most predominant type. It's changing that quickly. So this is more easily transmitted, but not necessarily, and maybe a little bit more serious if you get infected with it. But so far, the vaccines seem to hold up pretty well against this particular variant. Another variant that is not very common in this country, but is present in a few places, has been found, is the so-called South Africa variant. This one is much less susceptible to vaccines and monoclonal antibodies. And so this is one that the vaccine manufacturers are already starting to make adjustments to their vaccines in case this becomes a predominant issue in the future. The last one, there are very few of in this country, but it is really rampant in Brazil, where the COVID problem is significant. That's the P1 variant, or the Brazil variant. It has mutations that are similar to the South Africa variant, so it is expected to also be less susceptible to vaccines than monoclonal antibodies. So if we look at a graph of the variants, if we look over here, this is just maybe the 5 most common ones. And back at the beginning of the year, you don't see any of the B117. The B117 is the light orange. And then in the time since January, this is only the middle of March, you see how many of the viruses are the B117 variant to the left there. So what we expect is that the B117 variant is going to continue becoming more predominant. So this is something that is of concern and something that we need to be wary of, but so far the vaccines that we have seem to be very effective against the B117. If we look at what's happening in our country in terms of the cases, we were doing really well after our peak in January. And had I had this talk a few weeks ago, I would have said that things are looking good and the numbers are down. And then we kind of hit a little bit of a plateau in the end of March. And now, unfortunately, we're starting to head back up again. So hopefully we're not headed for another peak, but certainly the numbers are not headed in the right direction in the last week or two. In Pennsylvania, even more so. If we see what's happening there, the numbers going up more sharply than even in the rest of the country. Lancaster County, also the numbers are going up. I was just at Lancaster General last night, and the inpatient census there of COVID patients right now is 60. A month ago it was 15. So even locally, our numbers are not headed in the right direction, and we know that also from our county positivity rates, which are now approaching 10%, and they have been, down close to 5 a few weeks ago. So concerning in that the numbers are starting to go back up again locally. Of course, the reason we're talking about this is because we all work in long-term care, and COVID has been a big issue for long-term care. The long-term care population in this country really only represents less than 1% of the U.S. population, and only represented 4% of the cases in the country so far, but we're responsible for 1/3 of the deaths. So that gives you some idea of how devastating COVID has been to the long-term care population. And in our own state of Pennsylvania, we're responsible for more than half of the COVID deaths within the state. The good news is if you look at the number of COVID cases in long-term care across the country, you see what's happening. If those cases are at their lowest numbers that they've been since we started counting. And that's starting back in midsummer, I guess it was. So that's very encouraging. Apart from what's happening in our community, what's happening in long-term care so far is encouraging. If we look in Pennsylvania at long-term care cases, you see how low, those numbers have not been that low since the pandemic started. So that's very encouraging. If you see those 2 peaks there, see where we were back in December, that large peak, and now we're way down compared to, we're close to where we were at the beginning of the pandemic. And the same is true of deaths in long-term care. So deaths are dramatically down in long-term care. Again, much lower than they were even at the beginning of the early weeks of the pandemic. If we look at sort of where we stand at St. Anne's in terms of what COVID has meant to our residents and staff, so far, these are our statistics. We had 20 residents, and I counted 7 deaths, and there were some residents who got over COVID, but within a month they passed, and so I counted those as well. So we did have 32 staff members who were positive during this epidemic. So it has touched all of us in many ways. In terms of treatments, there are a few new things. We don't change a lot in terms of how we treat the patients at the hospital these days, but we have an antiviral medication called remdesivir, which slows down the virus and people get home sooner with it. It doesn't necessarily improve survival, but it's kind of like taking Tamiflu for the influenza. It does help some. The biggest benefit, the biggest therapeutic change has been in the use of steroids or dexamethasone. This helps to limit the inflammation, and this is what people often really struggle with late in the course of COVID. And this has improved survival by a significant amount. So we're seeing people do much better when they're in the hospital with COVID than they did at the beginning of the pandemic. The survival rate is much improved these days. We're still using plasma, but I would say that there's a little bit of debate about how effective that is. It needs to be used very early on, and it has to be plasma that is very high in antibody levels. So it is used in some cases, but probably not as much as we were using at the beginning of the pandemic. The big change has been in the use of monoclonal antibodies. So these are manufactured antibodies that are specific to the coronavirus, the spike protein of the coronavirus. And this is a treatment for outpatients. So this is not a hospital treatment. This is a kind of treatment that I would prescribe for my patients in the office whenever we find out that they're positive for COVID, and if they have risk factors and we're concerned that they may progress to the point of having severe complications of COVID, needing hospitalization. And it's an IV infusion, one-time infusion, and it has been shown to reduce hospitalizations. This is something that we would be using here if we had COVID infections in the future. So it is available for nursing home patients as well. The problem with this, as I mentioned before, is that if there's a lot of change in the shape of that spike protein on the coronavirus, these antibodies may not work as well for some of the variants. And so time will tell about whether these antibodies need to be adjusted for some of these variants. One medication, one treatment that is kind of unique and something else that is new is the use of fluvoxamine or Luvox. This is an antidepressant and a drug that we use to treat OCD, so a psychiatric condition. But it has been shown to, like the COVID antibodies, to reduce the progression of COVID to a more serious condition that requires hospitalization. So far there's only been one fairly small study, but in that study, when they divided the two groups into half, about 10% or so got sick and needed to go to the hospital, who had the placebo, but the people who had the fluvoxamine really didn't get worse, didn't need to go to the hospital. So there's a larger study that's ongoing with this, but if this turns out to be, if it shows this much promise, this will be a pretty easy treatment of a drug that's not very expensive, it's already available, and doesn't have a lot of side effects. So I'm hoping that this will show promise in the larger studies. In terms of other treatments for COVID, this is probably something that you've read about. Studies early on showed that people who got really sick with COVID in the hospital had low vitamin D levels, and so one would assume that if we give people vitamin D, they would do better. Doesn't necessarily work that way, but that was something that was tried. So there was a trial where they gave hospitalized patients large doses of vitamin D as part of the treatment for COVID. Unfortunately, didn't make any difference. It does seem that in certain populations, perhaps in the African American population, if you have a lower vitamin D level, there's a greater risk for you getting more severe COVID. That doesn't necessarily hold up in the white population, but that's something that's being looked at. So I usually tell my patients, taking vitamin D is not harmful, but don't expect that it's going to prevent you from getting COVID necessarily. Other vitamins that you may have read about or people have taken, and actually at one point some folks were even prescribing in the hospital, vitamin C and zinc. Early on there was a thought that these would be beneficial. There's some evidence that they help other respiratory viruses. You're familiar with some over-the-counter cold treatments that contain vitamins C and zinc. So they actually did a study where they randomized people to getting vitamin C or zinc or a placebo or both vitamin C and zinc, and there was no difference, unfortunately. So it looks like vitamin C and zinc really don't, at least for people who already have COVID, it doesn't seem to change. It doesn't improve their course. The real action and the real improvements, and what's really most exciting, I think, is what's happening with the vaccines. This is what's really making the biggest difference in our battle with this pandemic. There's a whole lot of vaccine trials underway. As of now, there's still 58 different vaccines that are being tried. Many of them are far away from being approved, and I'm sure a lot of them probably won't ever get approved, but there's a whole lot of work that's being done. Remember, the vaccine is a way to induce our body's own immune system to recognize the coronavirus and attack it right away before it has a chance to start replicating and making us ill. And I really think that this is the only way that this pandemic is going to end, is if a significant amount of people are able to get vaccinated and stop the transmission of the virus. The three most common types of vaccines that are currently in use, there's the mRNA vaccines, that's the Pfizer and the Moderna vaccine that we're familiar with. That uses a little piece of messenger RNA, and that little piece of messenger RNA is in the vaccine that gets injected into our muscle, in our arm, and our muscle cells start to make a protein that codes for the spike on the coronavirus. And so our muscle cells actually make this protein that is actually a coronavirus protein. And so our immune systems recognize these little pieces of protein that our muscle cells are making. They recognize that as foreign. That turns on our immune system so that if our body comes in contact with that protein again on a real coronavirus that we've inhaled, we're ready for it, our immune system is primed, and we can withstand and prevent that virus from replicating in our body. So that's the messenger RNA virus. The adenovirus type of vaccine, that would be the J&J vaccine that you're familiar with. They take a little piece of DNA and they stick it inside a virus, a cold virus, one that is not going to make us sick, but is a way for that DNA to get into our cells. So that's what gets injected in that particular vaccine. Again, the body produces that spike protein and induces immune response. There are some Some vaccines that are being produced in other countries, some of the Chinese and the Russian vaccines, where they just simply get that spike protein from the viral particle, they purify that spike protein, and that's what they inject in the vaccine. So it's just a protein that gets injected, and the body recognizes that as foreign and produces antibodies against it. So far, as of today, of the adult population over 18, 23% are vaccinated in this country. 40% of the population over 18 has had one vaccine, and 55% of seniors over 65 are fully vaccinated. So that's significant, and I think that's quite hopeful. So if we look at what's happening in the real world with the vaccines, there was an interesting study out of Israel where everyone in Israel got the Pfizer vaccine. And they studied the population of Israel, and what they found is that Pfizer vaccine prevented 97% of hospitalizations and deaths, and prevented 94% of people even with asymptomatic infection. So it was just a wonderful result from that vaccine. And this is a real world setting. This is the whole population of the country that's being vaccinated. The important thing is that at that time that they did the study, 80% of the variants were the UK variant. So there was a lot of the variant circulating in Israel at the time that they did that study. So the Pfizer vaccine seemed to do very well against the UK variant in that study. The other thing that we have been wondering about and not being able to really say for sure is, does the vaccine prevent you from transmitting the virus to other people? Because we haven't really had good evidence one way or another. Recently, this past week, there was a study that came out from the CDC where they did a study with healthcare workers. They vaccinated them, and they had them swab their nose every week for COVID, whether they had symptoms or not. So everybody swabbed their nose every week after they got vaccinated. And what they found was that after one dose, there was 80% protection against any infection, symptomatic or asymptomatic. And after 2 doses, there was 90% protection. So no virus was being transmitted 90% of the time. So what that means is that, and this was the Pfizer and the Moderna vaccine, so what that means is the vaccines are effective at preventing transmission. That was something we didn't know before, because previous studies we only tested to see whether they prevented symptomatic infections. Now we actually have evidence that they prevent asymptomatic infections as well. The other thing that we didn't have a lot of information about was pregnancy. So the CDC, when they've developed an app that you can sign up for, and you can register when you get your COVID vaccine. And so far, in this country, 70,000 pregnant women have been vaccinated. And there haven't been any adverse signals of problems amongst those 70,000 people. Now, that's not an official study, that's just them monitoring what people are reporting on their app after they've been vaccinated. What we do know is that the vaccination does produce high levels of protective antibodies in the fetus of pregnant women. So when they test the cord blood, the umbilical cord blood of the baby when it's born, they find high levels of the antibodies that are protective against COVID. So those antibodies pass through the placenta from the mother to the baby and provide protection. There was a small study in Massachusetts where they looked at pregnant healthcare workers that got vaccinated. And they followed them closely, they followed their pregnancies, and they monitored their antibody levels, and they monitored their baby's antibody levels, and they found that there was no difference in terms of pregnancy outcomes, and they found actually that as I said, the antibody levels in the cord blood were elevated, meaning that the baby had protection at birth. We know that a pregnant woman is at higher risk for complications from COVID. So someone who's pregnant, if they get COVID, they're more likely to have a more complicated and higher risk situation than a non-pregnant woman of the same age. So the official recommendation isn't there yet, but it certainly looks like the vaccine is safe for pregnant women and probably confers protection both to the mother as well as the baby. In terms of breastfeeding, the situation is similar to what we see with the flu shot, in that the COVID antibodies are excreted in the breast milk, and again, that can be taken up by the baby during breastfeeding and provide additional protection. In terms of children, this week we just saw the first study with the Pfizer vaccine in the first group of children between the ages of 12 and 15. In that group, the vaccinated group of that study, none of them came down with any symptomatic cases of COVID. There were 18 cases in the unvaccinated group. So it seems to be very effective in children and well tolerated. So they're going to continue these studies with younger and younger age groups, and the Moderna and J&J vaccine studies are underway as well for children. So my hope is that, maybe by fall or late summer, we'll have approval for vaccination for children, hopefully in time for them going back to school. As we know, the vaccines are very effective for seniors, providing in the neighborhood of 90% protection. What's most encouraging to me is if you look at what happened to the number of cases of COVID in the country and in long-term care when vaccination started. If you see that line there, that's when vaccination started, and you see that the incidence of COVID in the nursing homes and COVID in the community, they kind of went hand in hand. As community levels went up, nursing home levels went up. And then at that line, we started vaccinating. And you can see what happened. The red line is the number of deaths among nursing home patients. And the black line is the number of deaths in the community. And you can see how they diverge. Meaning that once we started vaccinating seniors, the death rate went down from COVID. But the death rate in the community continued to rise during that same time. So again, if we look at new cases among nursing home residents, the numbers are much lower than they have been since the early days of the pandemic. And actually, this slide ends at 1,300, and that was at the beginning of the month. That number is now down to 700. So it's even fallen in half more recently. Same is true of deaths. Numbers of deaths in the nursing home communities in the U.S. have dramatically fallen, really since December. And again, another slide to show the orange line is kind of the decline in COVID cases in the community, and the yellow line, the decline in nursing homes. And you can see the drop has been much greater in the nursing home population. So what that tells me is the vaccine has done what it's supposed to do. It has prevented and protected our most senior and vulnerable population in the nursing homes. So how are we doing at St. Anne's with our vaccinations? Here are the numbers. And I think we've done very well. Our residents have been very accepting of the vaccine, and our rates of vaccination are quite high. In the neighborhood of 95 to 96% of our residents at all different levels have gotten vaccinated. So that, I think, is very encouraging. We have some work to do with the staff. We're right now at around 62% or so, and so that Here's another look at that. The orange is the unvaccinated percent of staff, and the blue is the vaccinated percent. So you can see we have some vaccine hesitancy among the staff relative to the residents, and that's something that we need to continue to work at. But I'm optimistic that things will improve. In terms of safety, what we've learned about the vaccines is that by and by they have been very safe. Early on there was concerns about allergic anaphylactic reactions. There were reports of that when the vaccine first came out. It turns out that the incidence of that is about anywhere from 2 to 5 cases per million vaccinations. So it is very unlikely, and it's on par with what we would expect with other vaccines. There were reports also of increased deaths related to vaccination, particularly deaths in long-term care. That was circulating on social media. When they actually looked at that carefully, for example, in January, there were 129 people that died in long-term care shortly after receiving the vaccine. If you look at that population and look at what the expected death rate might be for that population, you know, it turned out that it was like 11,000. So, you know, persons at that age of their life in long-term care, we expect a certain percent of them are going to be dying on a daily basis. And so when we look carefully at the numbers, we did not see any increase in death rate, either in the general population or in the long-term care population. In terms of what people think about getting vaccinated, if you look at the bottom line here in December, about a third of the country said they want to get it as soon as possible, and about another 40% or so were going to say we're waiting and seeing. And with each month, you can see that the percent of people who are willing or have gotten the vaccination has increased. Now, there's still about a 13 or 15% group of the population that still says definitely not, but the group that says they're waiting and seeing is getting smaller. So I'm hopeful that more people will be willing to get vaccinated as they see how safe the vaccine is and as they see the benefits of getting vaccinated. In terms of what we know about the vaccine, we can say definitively about the vaccine. So far, whether it's the Moderna, the Pfizer, or the J&J, you can pretty much say that you are not going to be hospitalized or die from COVID 2 weeks after vaccination. That's pretty remarkable, I think. The Pfizer and Moderna vaccines seem to be in the neighborhood of 90% effective at even preventing asymptomatic infections. And so what that means is you're not going to be transmitting it without knowing it. And the serious side effects of this vaccine are very rare, and they haven't found any association with increase in terms of deaths related to the vaccine. And that's something that they look at very carefully. So there's a whole part of the CDC that monitors for side effects on a daily basis as people are being vaccinated. What we don't know yet about the vaccine for sure, because we just don't have enough experience, is we don't know how long this wonderful protection is going to last and whether there will be a need at some point for a booster. So time will tell. What we don't know is, is the virus going to change enough so that we're going to have to change the vaccine to give us a little more protection, whether we're going to need a booster that's modified to cover some of the variants. And honestly, because we don't know, we haven't had enough experience with the vaccine, we don't know, are there going to be any side effects 5 years from now? I think it's unlikely, but we obviously can't say that. There are lots of stories and myths and things about the vaccine that simply aren't true, and I would encourage you to try to have conversations about friends and relatives. When you hear these things, We know that the vaccine can't cause COVID. It doesn't have any viruses in it, so it's not possible that it can cause COVID. People who have had COVID have some degree of protection, but not nearly the amount of protection that you get from vaccination. So I encourage all of my patients who've already had COVID to get vaccinated. We know the antibody levels are hundreds or even thousands of times higher after vaccination as compared to after having an infection with COVID. The vaccine was not derived from fetal cells. There's no microchips involved. And there has also been some concern about fertility. And again, this has been looked at. There has been no association with increase in infertility related to the vaccine. Again, the most effective way we have of preventing COVID remains wearing our masks. So short of getting vaccinated, that's our best tool that we have. It also protects the person who's wearing it and the people around them, reducing that community spread. And you know, until everyone is vaccinated, I think it's going to be important that we keep wearing them. So what can we continue to do here at St. Anne's? The things that we've already been doing, that you hear about and you know, wearing your mask, washing your hands, keeping some distance. You know, we've been able to kind of stay abreast of what the virus is doing in our community with our testing. And that has been a helpful tool for us. And of course, the game changer has been vaccination. So this has allowed us to get to the point where we can start to relax some of the restrictions that we've been living with, our residents have been living with for the last year. So we're now starting to have family in-person visitation. We're starting to have the residents get together in the dining rooms. And hopefully, as long as things don't get too bad in the community, and our numbers don't get too bad, we'll be able to continue this open policy and continue to open up to try to get us back to a more level of normal. So where from here? You know, the pandemic is certainly not over. We're seeing numbers rise, unfortunately, but I do think the end is within sight. I will be surprised if we see the kinds of numbers that we saw back in January because we have so many people being vaccinated, so I don't think we're going to see those spikes. A lot of those numbers are in people who are younger and not going to be getting as sick. This is the population that hasn't been vaccinated yet. It really is a race between how quickly we vaccinate our population and how quickly the virus can mutate and new variants can evolve that will overcome our vaccine. So the quicker we get people vaccinated and the quicker we get those cases down, the less new variants are going to arise. So it really is a race between those two things. And if we continue to try to prevent spread by wearing our masks and doing all the mitigation things that we know work, and we encourage friends and relatives and whoever we can to get vaccinated so that they're not able to spread the virus, it's less likely that we're going to get to that point where we have to worry about variants causing another surge. So in the end, I'm optimistic that we are going to get through this and that hopefully we'll be getting close to the end of this terrible pandemic. So at that, I don't have any more slides. That's the end of my talk. Thank you very much.